So welcome to the Hemophilia Council of California's webinar, GHPP, How to Apply or Renew Your Application. I'm Lynn Kintz, the Executive Director of the Hemophilia Council of California. Thank you for joining us today for this important topic.
So what are some of the common causes for enrollment or renewal delay? One of the items is a missing photo ID. You've got to have a picture ID that shows your address. You have to be able to provide the verification of your California residency status. And as I mentioned on the last slide, that's usually a utility bill or something that shows that you live at that current address. Missing verification of income, again, the previous year's tax returns, but keep in mind that if your source of income has changed, if you've lost your job, if you've gone from full-time to part-time, that information is so important to go on the new application process because that is how your annual enrollment fee is determined. So clearly, if you've lost your job or if you've reduced your hours or if you are receiving less income than you had in the previous year, the state needs to know that so they can work with you on coming up with that new annual enrollment fee, working with you on a payment plan, or in some cases, waiving that annual enrollment fee altogether. Some of the other things that can delay your annual renewal is your pending medical eligibility, your incomplete application where you forget to designate your special care center. And there's also a place on the application to sign it. And I believe in a couple of places you have to actually initial. So those are all really important reminders so that your application doesn't get kicked out. And one other thing that we like to remind all of the hemophilia patients, and we'd also like to remind those in the sickle cell disease community and cystic fibrosis community, that it's so important to work with them on all of this information. And again, if your income has gone down, they need to know.
Thanks, Terry. So one more important piece of information about GHPP that is not as well known is a program that's part of GHPP called the Health Insurance Premium Reimbursement. And what this is that GHPP may pay a client's share of premiums for your employer-sponsored health insurance. So if you have the opportunity to have employer-sponsored health insurance, but you have an employee contribution that you have to make to help pay the premium of that, it is possible that GHPP may be able to pay your employee portion of your premium. GHPP clients that qualify for this program include those with hemophilia, cystic fibrosis, and sickle cell. Clients who are ineligible would be ones that are on Medi-Cal, Medicare, or whose health insurance premium is 100% employer paid. It is important to note, though, that this program does not cover the co-payments or the deductibles. So this is a program that they do participate in because it ultimately actually is a cost savings measure for GHPP. But if you have the option of an employer-sponsored health plan, this is something that you may want to look into with GHPP. So a couple things to watch out for. We recently have been told from the Department of Healthcare Services that all GHPP beneficiaries should have a benefit information card, or sometimes referred to as a BIC card. This is similar to the card that Medi-Cal recipients receive. We're not certain that all patients have that card readily available from the experience that we've heard in the bleeding disorders community. But if you have received your BIC card, please be sure that you keep this safe in the same way that you would an insurance card and carry it with you as you may need it in order to access services. In addition, please do not depend on GHPP to send you your renewal information. As Rigo mentioned, we would encourage you to mark your renewal date on the calendar and then set yourself a reminder 2 months prior to go ahead and download the application and submit it at that time, even if you have not yet received a copy of the application from GHPP. And as I mentioned previously, and I think that there's also been some comments in the chat about this as well, you know, A lot of providers are unfamiliar with GHPP, and that does sometimes present a challenge for accessing services. So I know that we here at HCC are available to help bleeding disorders patients navigate those issues along with their providers. And I think that there's been some comments from the Sickle Cell Foundation as well, offering to assist sickle cell patients with similar issues. So there are resources available to you if you're having problems getting access to treatment because of the provider's lack of familiarity.
During COVID, we at the council had over 30 cases that we had to interface with the state of California because some of the GHPP annual renewal applications were not being responded to. Part of the problem is that some of the GHPP staff was working in the home setting, and perhaps the faxes were going through to an office in Sacramento or in LA, where that person that would normally be handling those faxes was not there in person. So the department, all the way up to the director, has committed to working with the Hemophilia Council, and I'm sure he will commit to work with the Sickle Cell Disease Foundation as well to ensure that they handle these cases in the priority order, knowing that patients with rare conditions such as hemophilia, sickle cell disease, and cystic fibrosis can't go without your medications or your infusion therapy. So they are very well aware of some of the glitches that occurred, particularly this summer, and they are committed to helping all of you get access to the program. So for the hemophilia patients, contact us, and for the sickle cell disease community, I noticed in the chat room someone is there on for the Sickle Cell Disease Foundation of California. So that's awesome, and we can both together be resources for you. Any patients with cystic fibrosis, the Cystic Fibrosis Foundation is also a great resource to you. So to this slide, for information for the GHPP providers who may be on the call, remember that any other health insurance is always primary. So if you have private coverage plan through either your employer or the patient's employer, or the patient has covered California, you would bill that first as a provider and then GHPP secondary. You would, if you have Medi-Cal, you'd bill Medi-Cal first as well. The complete service authorization request, or SAR, must be submitted, and the SAR inquiries go to fax ghpp@dhcs.ca.gov or call 1-800-541-5555. Also send your claims to California MMIS Fiscal Intermediary, P.O. Box 526006, Sacramento, California, 95852-6006. Who can you call for help? Even during COVID, they are operating the GHPP program through normal business hours of 9 a.m. to 5 p.m. The staff now, even the staff working at home, they're picking up the email and the voicemail boxes, so you can still contact them. These are the current addresses: GHPP down at the Spring Street address down in LA, or the eligibility or application related inquiries can go to that email, ghppligibility@dhcs.ca.gov, or call 213-897-3574. And again, we encourage you to use all of this information first, but if you're having an emergency whereby you can't get your medication, for those with hemophilia, call us at the council, and for those with sickle cell disease, definitely go through the Sickle Cell Disease Foundation. But of course, if you can't get through, you can call us and we can help navigate the system for you. I've wanted to let people know also that Cayenne Wellness can also be a resource to folks, and their phone number is 818-731-5408. And they can speak to Kaylee Cook in LA, Shanti Johnson Harris in Central California, or Brian in San Diego. So those are some additional resources for you if you have sickle cell disease and need assistance.
I want to briefly just say thank you to everybody for joining us today. And also thank Terry and Rigo for helping to present this information, to thank Takeda and Sanofi Genzyme for sponsoring our webinar series. And thank you for joining us. Thank you again. Clearly there was a lot of interest in this topic, so we appreciate you all joining us.